What's going on, guys? Let me know when you log in. Let me know. Good morning, Samantha. Good morning, Alexa. Gotcha. If you have any questions, good morning, guys. If you have any questions, let me know. We're going to sit here and wait for people to log in. Good morning, guys. Good morning. Let me know if you have any questions, guys. Be happy to answer them right now before we get started. Good morning. Just take and roll. And again, if you have any questions while I'm doing this, let me know. Good morning, guys. Joseph, Bryant, gotcha. Ellie, Bohas, Sparks, Colin. Again, if you have any questions, fire away while I'm taking roll. Great time to ask. Shanice. Miss Sanchez, good morning. Hopefully you guys had a good weekend. Max Munoz, got you. Guadalupe Diaz. Karen. Marina, gotcha. Devin, gotcha. Okay. Brano Escobar, gotcha. Okay, a couple more minutes here. One more minute. We'll let some more people log in, then we'll get rolling. Should probably turn the music off. Waiting for a few more people. Just an FYI, got behind on some grading last week. I'll get that done this week. Hopefully that's a little better. Let me see here. See, there's like kind of a glare. I'll move this way. There we go. Cecilia, gotcha. Yeah, I got a little behind on grading. I'll get caught up in that. Tanya, good morning. I'll get caught up on that this week. I had a couple questions in my morning class, my 8 o'clock class about grading. I'll get caught up. So look for that. Besides that, we're just going to keep rolling, right? Just keep rolling through. We wrapped up last week our first unit, which was like just kind of overall general wellness. This week, we're going to introduce sexual health. And this kind of marks a switch in the material as far as it just being a little bit more specific, right? Now we'll just start talking sexual health, STDs, birth control methods. When we get into fitness, we'll start talking about, how to manage your weight, just very specific things, right? That, again, kind of a stripped down version. We have a little bit more time in class when we're normally in class to do this stuff, but, just looking at the way everyone's handling the whole COVID ERT online class thing, I just wanted things to be a little bit tighter, a little bit more concise, and me not be online with you for an hour and a half and just losing everyone and losing the message, right? So let's just stick to what's important. Hammer home those points, do assignments based off those points, and just move on, right? I think that's the best way to handle it. So with that said, sexual health, right? So the first part about understanding your sexual health is understanding your risk, right, of contracting an STD. And your risk is based significantly off stats. It's just based off numbers. It's in many regards, it's a numbers game. And what do I mean by that? Let's just throw some stats out there. And by stats and numbers, I don't necessarily mean that they're 100% true or factual for your individual situation. But, for the most part, numbers don't lie. Numbers are there because they're there. They're readable. They're measurable. And they are, for the most part, fairly factual. I mean, not across every situation or not across the board, but most people, if you behave in a certain way, in a certain area, under certain conditions, you fall in a statistical category that either puts you at high risk or low risk. I mean, that's just the bottom line. So let's throw out a couple of numbers here just for us to kind of hammer down this point that stats and there's certain categories that have a significant role in whether or not you will or are at the chance of contracting an STI or an STD. So with that said, the Santa Barbara County Rape Crisis Center has a statistic that in North Santa Barbara County, so that's basically Santa Maria, right? That's a code word for Santa Maria. In Santa Maria, you have a 1 in 2 chance of contracting an STD if you have sex without protection, without a male condom. Those odds are phenomenal. In other words, if we were at Chumash and we were told by the gaming people that you have a 50% chance of winning at this game, I would say we're going to play this game. We're going to play this game all night. We're not going to go to the other tables. We're not going to play the other games. Let's win some money. A 50% chance is pretty damn good chance, right? A 1 in 2 chance. Every 2 times you roll the dice, you're going to hit once. So 50% chance of contracting an STD if you have unprotected sex. Coupled with the fact that 70 to 75% of the population has HPV, right? Does anyone know what HPV is, right? HPV is, and I'll type it in here so you can look at it, human papilloma virus, which is a fancy word. Which is a fancy word for warts, right? HPV, human papilloma virus. There's hundreds of strands of HPV. There are a handful of strands that are contracted sexually, and there's a smaller number within that handful that are sexually transmitted. But here's the kicker. Those very small numbers that are transmitted sexually are partially responsible for oral cancer. And by numbers, what I mean by oral cancer is HPV, oral HPV, has now taken over as the number one source of oral cancer in America over tobacco use, over smoking, right? Those are significant numbers. And you're starting to see a lot more people talk about this. So let's say you're at a grad night and it got a little crazy and you hooked up with someone from another school, someone you don't know, or you hooked up with someone during 4th of July or something. Do you have HPV? No, but not necessarily, but statistically, it's highly likely, right? It's highly likely. So when we evaluate, are you at risk, we're really starting to look at the various numbers that put us in a high risk category, right? So let's move on. Let's start talking about those numbers. The first number to be aware of is, are you between the ages of 15 and 24? I think for all of you, that's yes, right? There may be someone in this class who's a little bit older, but there's definitely not anyone who's younger, right? So yeah, probably all of you are between the ages of 15 and 24. Why is that number relevant? Because that's where we see most STI and STD transmissions taking place, in that cohort, that decade, the ages between 15 and 24, right? There's a couple other high risk categories or groups of people, depending on, like, intravenous drug users are just at higher risk for certain STDs like AIDS, HIV, hepatitis, things of that nature. And there are a couple other groups, but by and large, most STDs are being transmitted by people who are between the ages of 15 and 24. The second number we got to be aware of is, have you had sex in the last 10 years? And that doesn't necessarily mean vaginal sex. It doesn't necessarily mean oral sex. That means any way in which you can transmit an STI or an STD. I'll get into that in a minute. But why 10 years? Why have you had sex in the last 10 years? For a couple of reasons. Well, for one reason, really, and that is incubation. Okay, incubation. In other words, your body will interact and react with viruses and bacteria. And it's highly likely that you have something, let's say HPV, herpes, even chlamydia. You have an STI or an STD, and your body is doing a good job of quelling or suppressing the symptoms. In other words, you have little to no signs, right? Most, like 3/4 of the new cases of herpes in America every year are transmitted by people who did not know they have herpes. Most people who have HPV do not know they have HPV, right? They don't know. There's no signs. There's no symptoms. Chlamydia is referred to as the silent epidemic because the symptoms are so small, right? So we definitely need to be aware of the fact that they're using that 10-year period because of incubation, right? But also because that 10-year period, it pretty much, you're going to show symptoms inside that 10-year period. Most people, most STDs will show symptoms inside of a month, but that's not always the case. There are cases of people who have debilitating diseases like STDs, STIs, like hepatitis for decades, 15, 20 years, all the while passing it on to people that they love, people that they're in relationships with, and not knowing that they had it, right? So again, stat number one, or the first number to be aware of, are you between the ages of 15 and 24? Number two, or stat number two is, have you had sex in the last 10 years? Okay. Number 3. Actually, before we go to number 3, let's talk about the 2 ways that that STDs are transmitted. Okay, that's a thing we need to pay attention to. And we're going to also talk about a spectrum, right? So we have what we call skin to skin, and we have what we call fluid to skin or fluid to fluid. Okay, so skin to skin is really simple. Even if you're wearing a condom and you're having vaginal sex, normal heterosexual sex, there's other parts of your body that are touching, right? Face, hands, other parts of your genitalia that are touching each other. So the condom doesn't 100% protect you from all skin-to-skin transmission. As a matter of fact, the male condom in skin to skin transmissions, the male condom reduces transmission by 50%. Okay, skin to skin transmissions go down using a male condom by 50%. That's a great number. Skin to skin transmission, all that really is if you are within 3 inches of the infected area. Okay, 3 inches of the infected area. Okay, you're still at risk for transmission. Fluid to fluid or fluid to skin is just that, fluid. So what are the fluids that can transmit STIs and STDs? Obviously blood, obviously semen, obviously vaginal fluid. Breast milk can transmit STIs. Urine can transmit STIs and other bloodborne pathogens and diseases. The one that's kind of out is saliva. Saliva itself does not transmit STIs or STDs. However, if you have a sore in your mouth and there's some fluid from that sore, or you have blood, a cut in your mouth, and there's blood in your saliva, that will obviously transmit STIs and STDs. Fluid to skin is an interesting one. In other words, if you got semen on your arm, provided there's not a cut, there's probably nothing that's going to happen to you, infected semen. But if you get infected semen in your eyes or in your nose or in your mouth or in your anus, that fluid, as long as it has a warm, moist mucous membrane area to proliferate, it will proliferate. In other words, you can get gonorrhea in your throat. You can get chlamydia in your throat. You can get gonorrhea in your eyes. You can get herpes in your eyes. You can get chlamydial infections in your mouth, syphilis infections in your mouth. You can get herpes up high and down low. So the fluid to fluid is a little bit different, but here's the great thing. The male condom, okay, so in skin-to-skin transmission, the male condom reduces skin-to-skin transmission by 50%. The male condom reduces fluid transmissions by 80%, right? And that's pretty obvious. I mean, the condom will catch semen, right? It will catch infected semen, and it will also stop infected vaginal fluid from penetrating the urethra, right? So you have that barrier. So getting back to our numbers, getting back to our spectrum, not only using protection puts you on the spectrum of low risk to high risk. So here's our low risk end of the spectrum. Here's our high risk end of the spectrum. Not only is protecting yourself, in other words, your behavior puts you at low risk or high risk, but your behavior also puts you at low risk or high risk depending on the type of sexual activity that you're engaging in. In other words, kissing one boyfriend or one girlfriend is a very low risk activity. You're over here. Obviously, the more people you kiss, the more chance you have of that virus pushing through the population more. Just like COVID. I mean, very similar to COVID. And I'm not saying you can cough and get herpes or cough and get chlamydia. What I'm saying is you are now providing an avenue for that virus to move through the population even more. So in other words, the more people you kiss and hook up with, the higher risk that you're at. But kissing is still a very low risk activity, right? So what's a high risk activity? Anal sex, right? There's going to be fluid transmission. There's going to be blood. There's going to be the breaking of skin, the breaking of blood vessels, having unprotected sex with multiple people, unprotected anal sex with multiple people, high risk sexual activity. So not only do the numbers as far as the amount of people that you engage in sexual activity with put you on the low risk to high risk spectrum, but the type of activity and your personal sexual behavior puts you at a low risk or a high risk. So the types of sex you engage in and whether or not you're protected very much will move that marker one way or another. The idea is obviously to limit your exposure, to limit the number of sexual partners, and not necessarily limit the amount of sex that you're having or necessarily even the type of sex that you're having. But just know that the more partners you have and the more types of sex that you engage in, you're inching further and further to what we call a high risk category or high risk behavior, right? So again, are you between the ages of 15 and 24? Have you had sex in the last 10 years? Number 3, how many partners have you had? Again, just like the types of sex that you're having, whether or not it's protected, the number of partners that you've had, have you had multiple partners, put you at a higher risk just because now that virus or that bacteria has a chance to push through the population, especially with something like HPV. You have HPV, you get it, you never get rid of it. You'll always have HPV in your system. And it's a very, very easily spread virus. In other words, most people get HPV when they're kids. And they get it because they're preschool and kindergarten and they're touching and they have things in their mouth and they put stuff in their mouth and they touch each other. And kids are always crowded, touching, grabbing. They have no sense of personal space whatsoever. That's what kind of proliferates that. But again, the more people that you come in physical contact with, sexual physical contact with, you're giving viruses the chance to kind of push through the population, if that makes sense. And then lastly, have you been tested? More importantly, how often are you tested? Right? If you're a sexually active person, and especially if you have multiple partners, you should be tested at least once a year, if not twice a year, every 6 months. And there's a couple of reasons for that. Number one, when you get tested, and we'll talk about this more next week, when you get tested, they test you pretty much for everything. In other words, if you go in there complaining of gonorrhea, they're going to test you. They're going to ask questions about the chances of you getting all types of STDs. And that's just because STDs have a tendency to run in groups. In other words, if you have gonorrhea, it's very likely that you have HPV. If you've had herpes, it's very likely you've been exposed to other STDs, right? So typically a full STD test will include urine, a swab, a visual inspection. Definitely, if you are actively infected with something like gonorrhea or chlamydia, they'll swab you. In other words, guys, you'll get a Q-tip about this long right up your urethra. Girls, your feet will be in stirrups. They're gonna take a little tissue off the cervix for a pap. Obviously, they're going to swab the vaginal wall. They'll swab your cheek. You'll do a urine test. You'll do a blood test. The doctor's going to want to look, right? If you walk into a doctor's office and say, I got like a rash down there, I don't know what's going on, he's going to say, let me see it, right? So they'll do the entire gamut of testing. And again, STDs have a tendency to run in groups. In other words, if you have had one, it's very likely you've had another or have been at least exposed to another STD. So getting tested is absolutely crucial to do annually. And it's weird, but the less you get tested, the higher chance you have of contracting it. And that's probably just a behavioral thing. There's no necessarily correlation between getting tested and getting STDs and STIs. The correlation is between your personal behavior, your sexual behavior, and STDs and STIs. It's not necessarily whether or not you're getting tested, but people who have a tendency to get tested have a tendency to care for themselves a little bit more, have a tendency to be engaged in their health a little bit more than people who don't get tested at all, right? So be a person who gets tested. Be a person who has that honest conversation. Look, I've had sex with 2-3 people. I hooked up with this one guy. I didn't really know him that well. We haven't talked at all. I don't even really know him that well, or I don't know her that well. Whatever the situation is, be on top of your health. Be on top of your oral cleanings, your teeth cleaning. Be on top of your physical, getting a physical and getting blood work, and just be on top of your health. Be on top of your sexual health. You guys, your age, the ages of 15 and 24, STDs are the number one source of disease. And the bottom line is, if you don't get tested, ladies, in particular, ladies, it's very possible you make a decision that affects you down the road, right? Living with multiple gonorrhea infections, multiple chlamydial infections, or having gonorrhea and chlamydia for too long and having it untreated can lead to pelvic inflammatory disease. You can render yourself infertile if you don't get tested. More importantly, if you don't get treated, right? If you do have an infection and you don't get treated. Ladies, if you contract HPV and it's the type of HPV that causes cervical cancer and you end up getting cervical cancer, your chances of taking a child full term diminish significantly. And full term is important. Full term, carrying a child full term is important because all of the crucial organs develop last, right? The eyes, the heart, the lungs, the kidney, all of these very crucial tissues that actually run our body, that run the body systems, that clean the blood, that clean the system, that oxygenate the blood, all of these very important things that allow us to absorb fat, absorb nutrients, to filter things out. All of those develop last, right? That's why a premature child is so dangerous, right? Not only that, people who are born prematurely are at a higher risk for diseases all throughout their life, not just at the beginning of their life, all throughout their life. So carrying a child full term is crucial, right? So getting at least an annual PAP, ladies, crucial, okay? Very, very crucial. Guys, same thing, but the bottom line is men have a tendency to be the carriers of STDs, the transporters of STDs. Women have a tendency to be the host. And that's just because there's a lot more real estate. I mean, that's the bottom line. There's a lot more depth to the sexual organs of a female, and they just have a tendency to get a little bit more damaged, right? In other words, there are very few cases of guys having a gonorrhea infection so bad that it renders them infertile. There is a chance, but women, you are almost for sure will suffer from pelvic inflammatory disease if you have a gonorrhea infection and don't get it treated, right? Ultimately, it'll catch up to you, okay? So here's your assignment for the day. I want you to locate 2 different places in town that provide STD, STI testing. And all I need you to do is list their name and address. That's all you're going to do today. Okay. Look around, find out where you can get STI, STD testing. Okay. All you're going to do is type in the name, the address, boom, done deal. 2 different places in town. If you can't find one in town, find one in the next town over. Find one in Napomo, Lompoc, San Ynez Valley, whatever. Find a place that is reasonable for you to go to. Okay, that's your assignment for today. Make sure you do your assignment Wednesday. Again, starting a new unit, sexual health. If you have any questions, hit me up. If not, deuces. I'll see you next week. Okay, bye.